Hello, and welcome back to the Black Dental Reserve podcast. I'm your host, Dr. Bridget White, and today we're joined by the dynamic pediatric dental duo, Drs. Lynda and Krystle Dean-Duru. They provide integrative holistic care at their practice in Ashburn, Virginia, in the Washington, D.C. area. Dr. Lynda was born in Nigeria and obtained her dental education from University of Benin before moving to the States and pursuing residency at Howard University. Her specialty training was at Children's National Medical Center. Inspired by her mother's role in helping children grow into healthy adults, Dr. Krystle went on to pursue her dental degree at Virginia Commonwealth University after graduating from Columbia University, and she later was chief resident in her pediatric program in Brooklyn, New York. Drs. Dean-Duru each have extensive training in integrative holistic pediatric dentistry, including airway health and sleep breathing disorders, and their connection to growth and development. And they are both skilled in the most innovative therapies and technologies such as laser dentistry, 3D imaging, and good old tender loving care. You can learn more about their practice at kidszmile.com, KIDZ smile.com, and follow on their social media at Ashburn Children's Dentistry. Welcome to the show.
Thank you.
I'm so glad you guys are here. Pediatric dentistry is such an important part of the profession, and your website is so extensive. I learned myself about its evolution, beginning with the Egyptian dental health, and then as it's evolved here in the States, especially with all the research going into growth and development. And as we see adults suffering from breathing disorders, and I understand personal experiences that Dr. Lynda, that you had and your family, and even in your own care, that have inspired you to really find your niche in pediatric dentistry and just add so much to the profession. So thank you guys for being here. With that said, can you explain this, the holistic approach in your practice philosophy?
A child to grow to their best potential is the best way to keep them healthy and keep them being their best selves.
This way of thinking, root cause approach, and helping sleep, helping breathing disorders, which are end stage, that can all be preventable. So
not many people think about going to the dentist or going to a pediatric dentist from birth. They're just waiting for teeth to come in. However, it's important to understand that those teeth come in a structure that needs to be developed well so that the teeth can come in properly and not crooked. And that starts from birth, like I said, and that you can already tell when a baby has trouble latching. So when the baby is born, they should be able to take a big, huge breath that kicks in the suck swallow breathe reflex. And that allows them to now just breast crawl, go to the breast, and just nurse naturally. So if a baby is having trouble latching or having trouble, or the mom's having pain, no difficulty breastfeeding at all, then they should reach out to someone who's knowledgeable about it. Most of us are trained to do that. It's a specialty interest that we had, and we had advanced training for that. Most people will go to their pediatrician first, or even a lactation consultant. So the lactation consultants will know that there are different things that affect the baby that will make it harder for them to latch. One of them is the birth experience. What did that baby go through when they were coming through the canal, or even from a C-section as well? So
my son is 10, but I remember when he was born, that first day of nursing and the milk and the skin to skin. And I was lucky. My son was born abroad in Germany, and they have a very much more developed midwives, prenatal. Yeah. So they were right in there with me, unwrapping the baby and, monitoring his temperature. But it's so true. We have patients who may note that, he wasn't nursing well, so I just put him on the bottle, or they overlooked it. And then also hearing that pediatricians say, oh, okay, when the teeth come in, go to the dentist. And we may do so much when the babies are born, how to feed, what they should be eating, right? How to clean their bodies. But then when the teeth come in, we just kind of say, oh, go over there to the dentist. So it definitely is holistic. Um, and I want you guys to get into that. But Dr. Lynda, I have to ask you, I read about you grew up the oldest of nine siblings, and which is remarkable. I'm number two of four, and I would say I have two little sisters. But if I had so many younger siblings, that's quite a responsibility. And it was your brother's experience with a toothache that inspired you. Can you talk about that experience, what that was like, especially in Nigeria, and how it motivated you to pursue dental health?
Originally, as you said, from Nigeria, and the first of 9 children, 8 surviving. First girl, me, and then the last one's a girl. So I have 6 brothers in between me.
Wow.
So it was quite a bit of taking care to do. And so while we're growing up, and you're halfway decent at school, your parents will tell, oh, you'd be a doctor. And of course, you take on that personality. I'm going to be a doctor. And anyhow, so one of my youngest siblings had a toothache and he couldn't sleep. And I had to lap him, put him on my back and walk the balcony at night so that he could get some relief. And he didn't want anybody else taking care of him but me. So eventually when we did get to the dentist and they took out the tooth that was a problem, he felt like a different kid. And right there, I looked at the doctor and said, what do you do to be this kind of doctor? And then she said, oh, it's going to be difficult. It's this, it's this. And I said, I don't care. That's the kind of doctor I want to be. Now, mind you, back then at home, it wasn't very popular for women to even aspire to go to medical school and even worse still, dental school. There were not many dental schools, so it was very, very difficult to get into program and finish through that program because it was like you were doing medicine and dentistry combined because you could be the only DR, the only doctor in a 50-mile radius. And you can't tell someone with malaria, oh, I can't treat you because I'm just a dentist. That's not going to happen. So it was very, very, very difficult. And I was not going to give up. I did very well. Actually, I graduated top of my class, as a matter of fact. So I'm very proud of that training that we did get from there. So, and now even going to dental school and understanding that what my brother had was totally preventable made me want to make sure that no other child would ever have to go through the pain because that trauma never leaves you. And even for me, who was taking care of him, I still remember it. And I was very young, but it still hasn't left. However, it did inspire me to make sure that our practice was more proactively preventive, because there's a big difference between prevention and proactive prevention. Proactive prevention meaning you can already see it before it comes and do whatever you need to do so that that doesn't even come at all, which kind of sets us apart and it makes it a little bit different for a lot of people to understand. But it's right from here and it's just not going away.
And the research is there too.
And
So
the
science
research
behind it.
Yeah, there's of course science and research behind it, and a lot of training, a lot of education, postgraduate, post going through dental school, post going through the general hospital residency, which I did at our University Hospital, and the 2-year excellent program that I had at Children's National Medical Center in Washington, D.C. So it's been a lot of training to be able to keep up with the technology and the research and make sure that we're giving the best to our children.
Yeah, it's an exciting time to be in the profession. I feel like so much the technology, the boom is right now it's like, everybody's trying to keep up and we're trying to see we knew we're looking at so many things at the same time. We're looking at growth and development. We're looking at children suffering from ailments that are preventable, and we're able to look at it, especially from an oral facial perspective, at how it leads to self-esteem. Like I think I read that attention deficit, self-esteem. In adults, it may manifest as fatigue or lethargy, but in children, it really shows in their behavior at school.
Yeah.
I mean, yeah, Dr. Krystle, I wanted, you guys have, you growing up in the States, going to New York, Columbia, love Columbia. I wanted to hear about, like, you studied psychology and, in terms of, you knew you wanted to follow your mother's path. First of all, I have to ask, did you feel pressure to following your mother's path? How was that?
Let me tell you, I get that question all the time, but to be very honest with you, maybe she did some Jedi mind tricks. I'm not sure. But at the age of 8, I always wanted to be in healthcare and work with kids. I wanted to be a pediatric surgeon. And so when she was at Children's National Hospital in DC, I'd go to the dental office and say, oh, can I go see, can I go watch some surgeries or see the other doctors? So I wasn't necessarily interested in dentistry per se. And where that love came from is I started working as a dental assistant at age 16 at the office. And so because I didn't have an option, right? I had an option to either work at the library or work at the office. So that's where it started. And then you get to learn how to be professional. You get to learn how to work with people, talk with people. So at the time, of course, as a teenager, I'm not seeing the benefits. But during college, when I'm still pursuing that medical or just healthcare field with children, I definitely started to see, like, all right, I see how much she's having fun enjoying it. I enjoyed it while I was working with kids, because by this time I'm actually treating patients, meaning like I'm assisting, I'm doing their hygiene, I'm educating them, I'm affecting change already. And so it started to just really become a love. Like it was a slow love, and then it just became right after college. The way I wanted to pursue my life, I wanted to go into dentistry, and then you learn so much about dentistry. I mean, I'm a complete nerd, so you learn so much about dentistry and how much impact you have. You think about it, you're like, wait, I'm here. That deals with a lot. That has a lot of impact. And then with kids, especially, you have a lifetime of impact. And so she didn't have to do much convincing. Didn't have to. She did zero convincing. Actually, she was like, okay, yeah, do whatever you want to do. But I think she knew that this was, and I'd always known, even going into dentistry, because she'd already started using lasers early. She had already started seeing infants and treating them for breastfeeding support for moms very early. To the point where, we're the Fruit Loops in a box of Cheerios, and we're okay with that. And so going into dental school and going into residency, I'd already was like, this is it. I only want to see kids, number one. And this is where I want to practice, because I know it's more progressive. I know I'm going to be learning really cool things, and I'm going to be doing a lot of cool things too as well. So, there was no pressure to answer your question. Possible Jedi mind tricks? I don't know.
I suppose the only thing I did was just expose them to what I was doing.
Yeah.
Even when I was with someone else during the summers when there was no school, I'd just take them to work with me. And I was not thinking, where we come from, how it is. You got to like help and guide and shape the child. And there's only so much of that you can do here, not to affect their psyche too much. But I just said, okay, you're going to come to work. You'll come to work with me. I'll pay. Either that or you work at the library, because there's not going to work at the mall. That's it.
Right. No more. That's wonderful. Yeah. No, that's perfect. I mean, I was going to ask about mentors. In terms of being away from home for school, for undergrad at Columbia, I've read about Columbia's SHEP program, the summer help, the initiatives to get more children interested in dentistry from underrepresented backgrounds. You majored in psych, which I think applies. Yeah, it's a perfect segue.
Too. Actually, that was part of maybe wanting to work with kids and wanting to just understand how kids become the adults that they are. I think part of understanding the way the mind works was huge for me, and understanding even neurology and neuroscience, and how this little thing here and everything just affects not only, emotional psychology, your mental psychology, your physical health, how all of that, comes to play, and learning further down that, trauma can be physical and emotional, but the brain sees it the same way, and
Yeah.
so that's huge, and that's huge, especially when we're impacting children, and setting their core memories, and their core like beliefs and things like that. So I already knew I wanted to do that. I wanted to definitely have psychology in my background for sure, just in general. Yeah.
One thing to consider is just being exposed to the profession, and then also using education to grow your own interest and your expertise, right? Because dentists are very interpersonal. We don't have the luxury of always walking into a OR and everybody sleep. We actually have to very intimate.
We also have to know how to set boundaries, but also hold space for ourselves, our patients. We have to know how to teach. Have to know how to interact, and still go home, interact with family. I have my family now. I don't have, children or anything like that yet, but I want to have those skills to be able to have my work, be able to interact with patients, interact with children, interact with their parents, and then be able to interact with my own family.
I wanted to talk about the airway health. I mean, this is, in general, the research, is it that we're just hearing more about it? Can you talk about your training and really explain for our audience how a healthy airway is significant with childhood development, growth and development, physical as well as behavioral? Can you talk about airway health?
I'll kind of give a little bit like how it relates to the teeth, because that's what a lot of parents, patients are like, what does this have to do with the teeth? Like, why is my dentist telling me this and not my pediatrician? And I think we touched a lot about infancy, and how you come into this world affects how your face develops and grows. We talk about breastfeeding and the tongue and things like that, and we realize that the airway is just a tube behind our tongue and our maxilla and our mandible is right behind there, right? And so if everything's underdeveloped, and if you think about it, everybody, almost 90% of kids need braces, right? So we have to ask ourselves why, right? Why are we so underdeveloped? Why are we so crowded, or why are we so narrow, to get to the point of needing to get it adjusted, right? And so back to what I was saying, the airway is right behind our jaws and our tongue. And so if our volume, if what we came in or what we have is not big enough, then we start affecting how we breathe. And we're only supposed to breathe through our nose. And the roof of our mouth is the floor of our nose, and some of actually the pretty much the shape of our nose. So if that's not developed well, then this thing that we're supposed to breathe through, that's the way we get the best air, the most healthy air. If that's not developed well, then we start to have a whole host of issues. And we talk about sleep because that's when especially for children, that's when they grow. That's when our bodies are supposed to repair. That's when our brains are supposed to wash away the toxins. And if, say, our tongue, if we don't have a lot of room for our mouth, our jaws, our tongues fall back into our airway, and then when we're sleeping, we're snoring, we're mouth breathing, so we're tossing and turning, we're fragmenting that peaceful time that the body needs, the brain needs to really regenerate itself, right? And so that's when you see a lot more issues coming from sleep. We talk about sleep, but it's really during the day as well. And the research is what's coming out is that OSA, which is the end stage of obstructive sleep apnea, is it's becoming more prevalent than even heart disease. It's actually becoming an indication or one of the comorbidities as to why we're having all these really diabetes, why we're having all these chronic illnesses. And then for kids, it's showing up differently, it's showing up in hyperactivity, it's showing up in behavioral issues, it's showing up as allergies, it's showing up as all types of things, asthma, things that we were like, oh, this is normal, right? It's so common that it's not normal. It's just that it's so common because of how we're all developing, which is, the research has been there. There are many anthropological studies that actually focus on just the jaws and the mouth and our head and neck. And then they focus on our diet, and they focus on, combining in the development of that and how they actually relate to these downstream effects that we're seeing now, right? We're just seeing them now because there's more money going to the hospital or to insurance companies to pay for end stage diseases. Meanwhile, it is actually preventable or preventative. Is it finding out more about it now? Yes, because we have more technology to interact and talk about it more, but the research has been there for a long time. Dentistry and ENTs, we were supposed to be together, right? Because we're working in the same area. Orthodontics changed because you can commercialize going a bit quicker and putting a lot more force and making a Hollywood smile than actually creating a structure and function and foundation, right? We forgot about the muscles. We forgot about the tongue. We forgot about, because then the tongue yields to bone, right? We know form and function. We learned it all in school. We just didn't really focus on it and then talk about the implications. We talked about doing and cutting and fixing disease instead of creating health. We can go on and on, but
wow, this is great. I was about to say, do you teach a course, Dr. Krystle? This is these are gems. I mean, especially for parents to understand. I mean, you'd never think it.
It's hard to, and that's why we bring in the psychology here, because you have to hold space for parents. They themselves went through, the ones that are like, oh yeah, I went through 3 rounds of braces, and I had the crank expander, this, and I had that, and I mean, I turned out okay. Meanwhile, behind the scenes, they're suffering. They're wearing night guards for how many years, right? We learned to make night guards to separate the teeth, but not understanding why are they having TMD issues? Why is TMD such a nebulous cloud in understanding? Why, right? Or why they're having sleep issues, or they're sleeping separately as husband and wife because one person is snoring like a freight train, right? Or they're having the unsexy Darth Vader, CPAP machine, whenever we do teach, we bring that picture up because that's what's happening, because we're finding ways to put Band-Aids on the symptom, but the research has been there. I mean, it's more coming out now. And I don't blame the fact that we don't know, because when you do know, you do better, right? And so
right.
Sometimes the research is there, but we didn't know how to synthesize it. We didn't know what to do about it. So now we know what to do about it. Now we know when to fix it. And when to fix it is when we start talking about maternal health, right? If mom is healthy, that womb is going to be healthy, right? It's going to be oxygenation, which is really important. And so the baby had already doing things in the womb can come out better, right? I mean, there's more to it, but it's really, really cool, really, really interesting. But being able to explain to parents, we're still learning how to do that. We just know we have to hold space. We just know that, we have to screen. I mean, even our governing body as dentists in 2017, they came out with a policy that said we need to be looking at sleep. The ADA mandate said we need to be screening for sleep, because the signs and symptoms you can already tell by the way a patient looks or the way a child looks, and that if you can treat, start treating, right? So part of the undertaking, which is more public policy now, is being able to educate our dentists, right? So that way they're not telling the patients, oh, that doesn't exist, right? Or that's just a fad. Because it's not a fad. The science is there, and the science is deep. And so that's part of it. And then being able, but the parents now know they're knowing a lot.
Social
Social
media,
media,
Google.
Google.
Yeah.
We definitely don't want them taking information and running with it in a different way, but they're desperate because they are with their children every day, and they're like, this is not part of my family. We've had some patients that were like, thank you for bringing this child back into our family, 4 or 5-year-old, right?
Wow.
Because you're able to either help kind of regulate the system, bring down the sympathetic overdrive that we're all in, right? Because we're breathing terribly. I mean, breathing is complicated in and of itself, but we know that you have to approach it from the structure, the function, and then the behavior of breathing, right? That's where they talk about the stress and all of that, the outside stuff. But we have to make our bodies resilient to all of that stuff, and it's all preventable. So yes, explaining to parents and talking to them does sometimes. That's why we give a lot of time to our patients. We do give a lot of time to our patients, and which is hard, of course, in the business, and that's probably why it's hard for other practitioners to be like, oh, there's nothing to it. Like,
yeah.
but for us, we're like, okay, we need to bring awareness so there can be at least a place where people can, even practitioners can come and like, okay, let's talk about, let me show you where the research is. Take this course. Yeah, is it more expensive? Or is it more investment into your knowledge? Or if you're just like, I don't want to do that, go to them, then, send them to who knows and who's taking the time. But the awareness is important, and it really does start very, very young, like days old.
This is phenomenal. You guys have done so much research. Your website has so many of your the education that you pursued, and that's a resource for the community, for the dentists out here. If you have any questions about your children or what have you, even if your provider's not giving you that information, please go to kidsmile.com and look at this information. Listen to Doctors Lynda and Krystle talk about their research, talk about how it affects our children and development. And, this issue with maternal health and things starting from the womb, particularly for our community, it's like twofold. We have such limited access to care. A lot of patients, a lot of Black patients are, they're seeking comfort with Black providers. And then because we're so underrepresented, we are only 3% of the dental profession. And I believe it's probably less, if not the same with pediatric dentists. Can you talk about the links, the oral systemic link with maternal health, and then particularly, with airway, like maybe all of it? I don't know. Just kind of give us the gems about how that's all connected.
A lot of times they may not know what symptoms they're having, that they mean something in order to seek help. And sometimes even when they do voice out their concerns, they're not taken as seriously because we've always had that persona and outlook of being very strong people, being very strong women. And it becomes important because the environment of the womb affects how the child grows. The tongue is a second organ that forms right after the heart. So by 4 weeks in utero, it's already moving. It's already peristaltic, and that's even before the brain finishes forming, and is attached all the way to the tip of our toes. And so while the baby is in utero, it's practicing on all the things that it can do outside. So if the mom is not healthy, either nutritionally or they have sleep or fragmented sleep, which a lot of women have,
Right.
If they do even have a sleep test, they're not going to register obstructive sleep apnea, but they will have what's described as upper airway resistance syndrome, because they will be tired a lot and just not able to explain it. And most times they'll say, "Oh, you're just pregnant." No, it's not that you're just pregnant. It's the fact that there's this thing growing inside of you, pushing up against your diaphragm as well, and now you're breathing a lot more through your mouth instead of your nose. That air going through your mouth is not filtered, is not humidified. It doesn't have nitric oxide in it, which helps the the blood flow easily, and so your body is just generally not as healthy, So I keep going down this road, but you help me out here from where I have stopped.
Right, yeah. So essentially what we're saying is that paying attention to your health, we said the best time to have a baby is 2 years before conception, right? Obviously, like having good nutrition, making sure that your body, your fascia is not tight in certain places, making sure that if you have asthma or even if you have what we were just saying, upper airway resistance or the brain fog or you're breathing through your mouth or snoring, that you're checking those things out because again, the womb, that environment that womb is sitting in, that baby is really taking in everything. And they're already starting to practice a lot of things. And so there's that. And then the birth experience itself, right? If just recognizing, because I know things happen. We got to have the epidural, the Pitocin, and all of that. Those are exogenous ways to kind of get the baby out. So that means you're going to need a little bit more help because the baby had like kind of extra push to compress and more compressive forces. Mm-hmm. And we know that the face and the mouth and everything is formed from the base of the cranium. Mm-hmm. So I know we're going to go into like a whole thing, but essentially for moms, just being able, there's a recognition because all in all, as a whole, as a human, we're not as healthy as we could be, right? But the recognition of like, hey, this symptom that I'm having is a bigger deal than what I'm kind of keeping down, right? That's a huge thing for our health to be able to say, hey, I'm not feeling well for this, and this, and I think it may affect my child. I need to see this provider. I need to see an ENT. I need to see an airway dentist. I need to be able to make sure I'm optimizing my oxygenation, right? We just found out actually in a practice or a hospital in San Diego, they're already in the third trimester of a mom's during the pregnancy, she's having CPAP. They're putting intentionally giving CPAP. That means giving them air to oxygenate the womb, right? So imagine the baby comes out fully oxygenated, just well perfused with blood, all that. They're going to be a lot healthier than the baby that's coming out, or the mom as well that's having that, because they're together. They're one patient that's having, issues beforehand. So it's really, really important that we ourselves are taking our health a lot more seriously. If we're there's an increase in preeclampsia, increase in diabetes. Gestational diabetes, not prediabetes, gestational diabetes. So being able to know that, hey, maybe I should see an osteopath, like all those other type of allied health providers are extremely important. And maybe I should look into talking to a lactation consultant as well. So to teach me to know what's the right latch and what's not, because sometimes they're like, I breastfed for 2 years. It was fine. It was like not saying that, hey, it was painful. They were chomping. They were slipping off the breast. They were doing all other things. Spitting up, colic, like all those other things that you wouldn't.
You had mastitis.
Yeah. So moms that have mastitis, you would think, and I know I haven't had it, but moms, the stories, it was very painful, but they just kind of like, I thought it was normal. That is
right.
If I haven't had it, and they tell their stories, I'm like, that's a woman's. We need to stand
women's health, advocate.
They talk about, some of the pediatricians will say, oh no, your milk is not, or your breast is not working, your nipple's not working, you're not making milk, and so you just take it, and it's like that. We're naturally supposed to do something, unless you have a syndrome, unless you have something that has been found out that you're unable to do, right? But we're supposed to be able to.
If you make that baby, you will make milk.
Yes.
So the only reason that most times the milk is not coming out is because your body is not getting this proper stimulation by the baby with their tongue to let the brain know, hey, I still need milk here.
Yeah.
There is a hormonal process that goes through it, but that also depends on how well the baby is stimulating for the oxytocin to allow the milk to come down. So if you don't get it, then you won't. Then essentially, for moms to be able to know that I have a symptom, I have to find out about it. The first doctor you talk to is probably going to tell you, it's all in your head. Don't take that for an answer. Keep asking, keep searching.
Just ask why.
Until,
say, well, why? But why?
Yeah. Why? Always ask.
Why? There's part of the reason why a lot of the moms find us really is because they've gone, and this is why we want to change it, but they've gone to so many other providers who've been like, well, it's okay, you'll grow out of it, or they'll grow out of it, and they don't grow out of it. Like, kids will grow into things. They're gonna grow into the dysfunction. They're not gonna grow out of it, right? So
we do help them connect the dots.
Yeah.
Many times during the day, many parents, some of them are just tearing up and going, I knew something was wrong. And thank you for hearing me. And sometimes that's really what you can do. We see ourselves as quarterbacks here because we're triage. Not everything can we treat, right? But we understand that what's happening on your knee can affect your tongue. What's happening on your toes can affect how your tongue functions. And so sometimes, it's not just that, oh, let me just go cut it because there's a tie there. It's knowing and understanding that there's a lot of body connections and tension that could cause that tongue not to function properly. So the first thing to do is get the function right. Make sure the brain is getting the messaging and the tongue and the other areas are getting the messaging, which is that part of the neurology. And again, remember the brain senses all of this as trauma. And so we're always in a high sympathetic overdrive, which causes a lot of fight or flight, a lot of increase in cortisol, and a lot of inflammation, which itself will lead to a lot more diseases. So the first thing to get to the root, to the cause, is to get down the fight or flight so that the brain can actually function like it's supposed to, because our bodies are supposed to heal itself naturally. Our role would be to remove the obstacles so that it can actually heal itself.
The holistic approach is so fundamental. It's a shame that we're so developed, but we are a sickness health society. It's not wellness. And I think a lot of patients, like you said, they're not even aware. And then particularly Black women don't feel entitled to even explain their symptoms. And then to know that providers are not receptive to that is devastating. So that is a call to action for more Black dentists, for us to pursue this research, to reach out to Dr. Lynda, Dr. Krystle, and get this information to our patients. I'm learning so many things. I'm like, I'm breathing during pregnancy.
Totally related to what we do. All your patients who keep coming off, they keep getting fillings, they keep getting cavities. They're TMJ. They're always complaining about something. You've done like $50,000 worth of work, right? And it's ruined. Or the periodontal disease. That's increasing much more now that because of inflammation. There's a root cause to it because there's a cycle of internal stress. That because everyone's like, oh, stress. Like, yes,
right.
We have stress. But we're humans. We're supposed to be resilient. We're supposed to be able to figure out ways to figure out that stress so it doesn't, impact our bodies as much. But there's also our bodies aren't able to, resist and withstand some of that stress. And we need to find out why. You always have to find out why, So dentists, it behooves us really to go back to even some of our work from dental school that we just didn't pay attention to embryology. We didn't pay attention to physiology as much, right? That's all of it. It wasn't. We started learning more and more past dental school, which is what I would tell any person coming out of dental school. It's like, just don't think that this is the end. Understand that dental school is a great foundation for us to have the hand skills as practitioners. Now, to get the healing skills, you got to go to do more work. You just gotta learn, and there's better ways to do certain things.
It is such a great philosophy, your practice philosophy, and it's such great care and opportunity and access that you're providing your patients. my sister, my nephew had to have a frenectomy and she was so scared about it. They did it under sedation and he did well. But can you talk about the advancement in laser dentistry and just give us an example of a procedure that you commonly provide for children?
So that's an excellent question. And I hope everything went well. I'm so happy that I had a provider that was forward thinking to be able to release the tension and things like that. I want to say that lasers are tools, right? And especially for doing these soft tissue surgery, I think they're excellent tools to be able to get proper healing, to do even more precise work, to do like for us, we use it surgically and non-surgically, meaning if you've heard of photobiomodulation, there's more to that, right? So we use that for healing. Sometimes there's warts, sometimes there's bruises, sometimes there's herpetic lesions, things like that. Sometimes the way we use the non-surgical laser for babies and for even some mamas too, called mama laser. That's a whole different thing, but that goes into like reflexology and being able to if the laser can penetrate all the way down to the nerve without any kind of surgical or pain or heat to be able to wake up the nerve, right? So we talk about brain, we talk about how important the cranial nerves are. If you're waking up the nerves, you're also helping to wake up the tone of certain muscles and things like that. So that's in and of itself like a whole different. But for us, we're using lasers to take care of cavities without having to use Novocaine. For
That's been
since 2005. For the most part, we're not having to use lidocaine to take care of fillings or take care of cavities, which is amazing. And you're doing it's not your JV black because you're not having to take out a lot for retention. The laser's directed at the actual decay, right? So I'm not having to use my drill. Even thinking about the drill sometimes, I'm like, oh, it's like I'm going through meat, right? I'm taking it out. So it's different. Right? So that's been amazing too, because now the kid's more comfortable. You can do more work, and it's more comfortable for patients to be like, oh, I'm not numb, and I just did a whole bunch of work that I needed to do. Different types of surgeries, like we said, the frenums. In our office, like we use the dual wavelength, which is that non-surgical, to help make sure that we're only releasing what we need to release, meaning so that non-surgical helps to differentiate the fascia. It helps to melt the restricted fascia. That way you're only seeing a tongue, because a tongue tie is not just a bunch of tissue, it's a bunch of complicated tissue that never stretches, is not going away, right? So, but you have to differentiate. Sometimes because the body's so connected, you have other fascia and tension points, and you have to release that tension. So you're only getting that for, the frenum restriction. So we can use it for a lot of different types of surgery, gingivectomies, just more comfortably versus using a scalpel. Your healing time is so much less. It's just it's better. It's just but I always say it's a tool. So we do know ENTs and oral surgeons that are able to use their scissors and scalpels because that's the tool they've used. We just know that for the years and years that we've been using lasers, it's top notch. It really is. And it's just an easier procedure, especially if we're working with kids. So anything for us to make it comfortable for kids, that's our jam. If we do have to do sedation, we do IV sedation with a pediatric anesthesiologist. If we have, we have nitrous, so we have they're watching movies while we're working, like anything they need to just be relaxed and have a good experience, we're there for it. So whatever materials we're using, whatever that, and for their psyche, right? Like white fillings, white crowns, all types of things to just make sure that their dental experience or their oral health experience is top notch and not something they're looking back on like, oh my God.
Yeah, no, because it stays with them. That's when they come to me. They're like, I had a really bad experience and I didn't go to the dentist for 10 years and It's a disaster.
And they're like, I hate dentists.
The lasers, it requires a lot of training for you to be able to use it properly.
Yeah.
And so I would just be any other practitioner who wants to use lasers or who gets involved in it, open your minds up and be open to the training, get the training, because there's so much more that you can do with it. Yeah, the laser. Yeah, label. Again, it's knowing what wavelengths do, what to use when, and before you even buy one, think about what you want to do with one, and that way that can help you figure out which one to get, and then whichever one you get, train as much as possible so you can have the best outcome from it. Because it's not the tool, it's a practitioner. So it's how well you train, you can get excellent results with whatever tool you're using if you've done the training.
This is such a great conversation. And like you said, it's the practitioner, it's the technique. And just another reason to pursue pediatric dentistry, that it will not be taken out by AI. It's not going to go anywhere, because you need providers. You need sympathetic, empathetic, highly trained providers who are thinking outside of just removing decay or making your smile look nice. And I think especially in a time where we feel so much pressure to have these straight teeth or what have you, and we're not thinking about why they're not straight, why they're not functional, why our whole lifestyle is affected by the position of our teeth, our jaws, and things like that. So this is a recruitment for pediatric dentistry. It's innovative. It's yeah. It's because a lot of people think, oh my gosh, I have to like deal with kids all day, but it's
the parents that are
You might like to.
yeah. One of my friends did pedo because she's like, I can't talk to adults. They're more ready to help their children than themselves, right? Like, which is and that's all the reason why the airway information and understanding the breathing disorders and how it's connected to growth and development is so important for patient education and family education. So thank you so much, Dr. Lynda, Dr. Krystle, for joining us and giving this information. I'm going to have links to your websites, and we're going to really promote, the work that you're doing and hopefully collaborate. I'd love to showcase like some of these laser techniques. This is so fascinating. And I think especially with the younger generation recruiting more people to the profession, we wouldn't know, right? We wouldn't know what dentistry is an option available to us and what it really offers you in terms of a career, stimulation, and then a lifestyle. I mean, Dr. Krystle, I know you do your dancing, and I love to see you in the gym. So follow follow them on social media, because we're just women in society advocating for women, advocating for mothers and families, and we're all in this together. So this is wonderful. Thank you so much for joining me, and thank you for tuning into another episode of the Black Dental Reserve podcast. We'll see you next time.